As a small country dependent on trade, it is inevitable that for our economic survival, we have to open up the economy. Businesses are struggling and industries are decimated. We have to save lives and open up safely. In order to do both, a vaccine is the key. In the midst of this pandemic, there has been a lot of pandemic misinformation on how diseases spread and how vaccines work, which we will clear up in our video. We intend to implement a vaccine mandate, whereby anyone who is certified medically fit by a doctor has to take the 2 doses of vaccine. The intention is to allow us to return to a sense of normalcy while still combating and controlling the spread of COVID-19. Moving forward, Singapore plans to live with COVID-19 and treat it as an endemic. Our focus now shifts to reducing severe or serious infections. This is especially true for the Delta variant, which is far more deadly. When people are vaccinated, it significantly lowers their risk of serious symptoms if they were to be infected with COVID-19. This allows those infected to isolate and self-treat at home. In turn, this helps to ease the strain on public hospitals, as hospital beds would be used only for the more serious cases. In order for this to work, we need all who are eligible to be vaccinated. The coronavirus infects a person by attaching its spikes to a host cell. Those spikes offer a target for vaccines. Our immune system can utilize this vulnerability. The mRNA in the vaccine is used to arm the immune system, which can direct cells to make specific proteins through transcription using intracellular ribosomes. The mRNA tells our cells to make proteins that mimic COVID spikes. The antibodies then attach themselves to the spike proteins, rendering the virus useless, unable to attach to host cells and keeping our bodies safe. A study found the estimated mRNA vaccine effectiveness against documented COVID-19 Delta variant infection was 90% for adolescents and 93% for ages 7 to 21 after 2 doses. This shows the vaccine is highly effective across various age groups. Another study by the CDC in the US looked at the effectiveness of the main 2 mRNA vaccines, namely Pfizer-BioNTech and Moderna. The report found that the mRNA vaccines were 87% effective in preventing hospitalizations and remained highly effective even during Delta's dominance. This shows that while it is possible to get COVID after vaccination, side effects are far milder, allowing Singaporeans to be healthy and allow us to open up. In addition, using the 5-day moving average number of daily cases before and after the outbreak of the Delta variant, we have found the growth rate of the Delta variant to be higher at 0.0668 than the other variants of COVID-19 at 0.0181. This results in a higher basic reproduction rate of the Delta variant, and hence a higher rate of vaccination of about 90% is needed for herd immunity to be achieved, and hence open up safely. From an ethical perspective, mandatory vaccination policies support herd immunity. But mandatory vaccination requirements may be viewed as denying an individual the right to refuse healthcare treatment. Hence, the biggest long-term concern would be to continuously shape and improve people's perspective on vaccination so as to prevent it from being seen as draconian. We all need to do our part in eradicating this disease once and for all.